Good afternoon. This is Double Doc again, and as promised, we are going to focus on some more aspects associated with your success in passing the CADC on that first successful completion. Today, screening and assessment. Now, we want to begin with, are these two processes the same? You will actually see this as a question on the CADC. What would be your answer? And that would be either true or false. You have to know the definition of these two processes in order to successfully answer this question, right? So, a screener is something that is very quickly done, right? Whereas assessment is something that is a more complex process, and they are not the same. However, sometimes people begin to utilize these two notions interchangeably. Right? So we want to make sure that you are clear of the process. So, what is exactly the screening process? So, standardized tools used to identify aspects such as mental health symptoms and substance use and or abuse, and sometimes trauma. That is essentially what screening is about. Now, assessment, however, would essentially expound on those processes. Now, I'm going to give you some that you will definitely see on this CADC, right? And then I'm going to also focus on the populations that would typically be utilized when using these screeners and or assessments. But I also want to give you a heads up. So for me, as I talked about this in my previous video, in the easy peasy lemon squeezy to successful completion of the CADC, as a psychologist, right, I was going in with the lens that looked at clinical diagnosis and symptomology. So my focus was really just thinking about, hey, what am I seeing, right? And that was from a biopsychosocial formulation. All right, so which one would that be? What do you think? That would be assessment, because there are specific domains that we're looking at, right? We're looking at someone's physiological element, right? So any comorbid conditions, right? We're looking at spiritual aspects, right? We're looking at educational aspects, right? We're also looking at the familial aspects, what role the family plays in it. Okay, so that overall comprehensive element that entails assessment. And then, right, if we want to integrate, okay, that whole piece, we then could take some of the elements that are integrated from the screeners. Now, let's say we're working with someone who is an adolescent. Okay. Now, an adolescent, someone who's under the age of 14, right? Very powerful. Someone who's exposed to utilizing a substance as a maladaptive coping mechanism. How you can remember this as a screener, a cage has four sides: up, down, side, side, right? So you can remember what this acronym actually stands for in each letter, okay? So it's 4 questions. Think about it like this. Have you ever thought about, and this actual screener is really focused only on alcohol, thought about cutting down? That's your C. Are you annoyed about your level of alcohol consumption? Are you guilty in any way about the patterns of your alcohol consumption? And in the morning, do you need alcohol as a way to get yourself going. So that's your E. That's the CAGE. 4 quick questions. You score that. If you get yes on those, then yes, you would then make a general determination that there's a need for more assessment in the realm of alcohol use. Okay, so that's the CAGE, and that's one that is specifically utilized for adolescents. But there's also the CAGE 8. Now, the AID, there's no breakdown of what the AID, but that element is more centered on other substances such as cannabis, ecstasy, fentanyl, those things. Okay, but the general CAGE is just those 4 questions. Okay, hopefully that makes sense to you. Now there also is another one that is utilized for adolescents, and that is the CRAFFT. That is CRAFFT. Okay, and that screener is utilized for high risk in adolescents and drug use. Okay, and this is a 6-question screener. Okay, and it is specifically utilized to ascertain the behaviors that are associated with the actual risk surrounding the substance itself. Okay, now the CRAFFT, that acronym, okay, essentially is CAR, relax, association, friends, forget, and trouble. Okay, so that's what CRAFT stands for. If you can remember what the acronym stands for, but when you see it on the exam, they will actually have what the word at the acronym itself, and then they'll actually have what the meaning is, different meanings in of itself, but they'll have which screener is utilized typically to assess risk and use amongst adolescents. Okay, and it'll have the number of questions that's within the screener, and you have to be able to identify. That would be the CRAFT. Okay, so we talked about the CAGE, we talked about the CRAFT. Now there's one specifically that's used for adults. But it doesn't focus on alcohol consumption. It does not focus on alcohol consumption. And that is called the DAST. DAST. Okay? Drug Abuse Screening Test. Okay? And it's a screener for drug use problems, but it does not focus on alcohol. Okay, does not focus on alcohol, and it's used generally for adults and adults only. Okay, and then there is another one that actually focuses on depression in adults. Okay, and now here's the thing: if you know your DSM, right? How long does depression usually have to present? Because that's on the test too. Okay, that's that comorbid or co-occurring notion that's discussed, and it's 2 weeks. 2 weeks. Okay, and it's the Patient Health Questionnaire, PHQ-9, and it's for depression. Okay, so that's something that you want to be clear about, and it's for the depression severity. Okay, it's a 9 questionnaire, and it's based on self-report, and the higher the score, the greater the severity. Okay, higher the score, greater the severity. And then the final one that I remember that was on my exam, there was an addiction severity index. Now that the key word there is index. Okay. So this is also utilized primarily for adults. Okay. Now it really focuses on medical, legal, and psychiatric and substance use domains. Okay. For alcohol and substance use. All right. Now, think about when I first asked you the question about assessment and screening, if they were the same. This particular um, index could be used in alignment with a biopsychosocial because it looks at all of those domains, right, and gives you specific information associated with those particular areas. So this is a more in-depth, right, um, identifier. So it's more in alignment with assessment because it yields that complex information. Okay, so what we've gleaned today, that screening and assessment are not the same. However, screening happens before assessment. Taking that information from screening, you then build upon the information that will be uncovered through assessment. Assessment tools essentially are standardized. They're more geared towards certain populations, right? And then that information is then filtered in through to the assessment process. All right. If you have any further questions for me, please don't hesitate to reach out to me, your double doc. Success is achievable if you follow this meticulous process. Thank you very much.